Hi, my name is Eddy Lang, and I'm a professor and the department head for emergency medicine in Calgary. I'm also a member of a research team that published a paper earlier this month. This research may have important global public health implications and will be sure to spark a conversation amongst your family and friends. The story begins at the start of the pandemic. At that time, we witnessed a dramatic drop in the number of patients coming to emergency departments around the world, as well as those requiring admission to hospital. The drop was because people were worried about catching COVID. But once those initial fears abated, emergency physicians in Calgary noted something unusual. People with respiratory illnesses such as asthma and chronic obstructive pulmonary disease, commonly called COPD, were not returning in the same numbers as those with other conditions. This prompted us to do the first population level study in Canada, looking at how hospitalizations through the emergency department changed in the first 6 months of the pandemic. We wanted to see if all health conditions were affected equally by COVID control measures and if we could learn something that could teach us about how we can improve healthcare and healthcare spending. Our results were compelling. In the first 6 months after the declaration of a state of emergency, admissions for COPD and non COVID pneumonia fell by over 30%. This occurred while other conditions recovered to near pre pandemic levels. The drop in people coming to the emergency department was dramatic. The number of hospitalizations prevented in the first year of public health measures were more than the number of patients hospitalized for COVID during the same period. That's data from Alberta's 14 busiest hospitals. We have also discovered that this is a global phenomenon. In a study of more than 200 hospitals in the United States, the reduction in admissions for asthma, COPD, and pneumonia have remained at 50 to 60% below normal levels. These effects are also now being reported in Germany, Portugal, Scotland, Wales, Korea, and Singapore. There have been a number of theories proposed to explain this phenomenon. The most compelling, we think, is that along with the eradication of the influenza virus or flu that has been seen in so many jurisdictions, we have also eradicated common cold viruses. We believe that the improvement in respiratory health that we observed is likely related to the reduction in these viruses, which are known to trigger asthma, COPD, and non COVID pneumonia. The implications are intriguing and set the stage for consideration by researchers and policymakers. Until such time, anyone with a chronic respiratory illness or who would be at risk for hospitalization due to pneumonia should be aware of what appears to be a silver lining that COVID measures, such as wearing masks, physical distancing, and hand hygiene, have had on respiratory conditions.